Hello and welcome to EULAR final day. It's been a wonderful conference and it's been great talking to everyone as part of Room Now. Check out rheumnow.com for all of our fantastic content. Today I want to talk about one of the sessions from the final day at the conference. This is presentation 6882. It was a wonderful talk by Dr. Elena Nikiforou talking about diet and rheumatic disease. This is something that we all know comes up all the time. Patients ask questions. We feel like we don't have great evidence. There's no fantastic high quality study that can lead us always to give them the best diet, the perfect diet to eat. But Dr. Nikiforou gave us 10 practical things that she tells her patients that we could bring back to the bedside. I wanted to share those with you today. So first is nutrition. Nutrition plays a role in inflammation. We know that very well, that nutrition has pro-inflammatory effects, anti-inflammatory effects, and what you eat matters. So number two, the type of diet you choose matters. And she says the Western diet can be called the greatest enemy of chronic inflammatory conditions. So the foods that we eat over here in the States with our high processed foods, quick fast foods, high calorie, that causes inflammation and it can impact rheumatic disease. Number three, limit your salt intake, use more herbs. So salt is pro-inflammatory. There are lots of things on the spice rack. Go to those instead of just putting salt on top of your food for some flavoring or spicing. Number four, consume low glycemic index foods. Number five, oily fish and omega-3 are good. So omega-3 and omega-6, they're almost identical. They have a difference of one double bond. That one double bond makes all the difference. So omega-3 is anti-inflammatory. You find it in olive oil, soybean oil, flaxseed oil. It's in sardines, salmon. Omega-6, that's the opposite, pro-inflammatory. That's what's in corn oil, soybean oil, peanut oil. It's in meat, dairy, eggs. It's not that you have to throw those out, but it's the ratio that's important. So increasing omega-3, decreasing omega-6. The more you have that favorable ratio, the better anti-inflammatory effects in your diet. Number six, show preference to the Mediterranean diet. It's very high in those anti-inflammatory features. I ran a poll on my Twitter at EJDEIN, number one. That poll is still ongoing. I asked, what's the preferred diet amongst rheumatologists with their patients? Mediterranean is winning with over 3/4 of the votes right now. Intermittent fasting has about 18%, vegan about 5%. Not surprisingly, no one chose the American fast food diet. The Mediterranean diet, that's the preference from Dr. Nikiforou, that this is the best diet for increasing those anti-inflammatory positive effects in your nutrition. Number seven, again, increase the amount of anti-inflammatory foods, reduce the pro-inflammatory diets. So again, with that ratio, taking as much of the good stuff, decreasing the bad. Number eight, this is the one that hits home, coffee in moderation, show preference for tea, namely green tea. So when she said this, I had 2 cups of coffee sitting in front of me and it was only 10 in the morning. We do know that coffee consumption of 4 or more cups per day has a relative risk of 2.2 times for seropositive RA. We know that coffee is linked to seropositive RA regardless of the caffeine consumption. So there's something intrinsic in coffee that can stimulate rheumatic disease. Green tea, on the contrary, that's anti-inflammatory. So that has lots of good beneficial effects. So try to decrease the coffee, and if you can, maybe use that transition over to green tea. Number 9, important to keep good control of coexisting conditions. And along with that, number 10, maintain an optimal BMI and keep fit. Fat being pro-inflammatory, exercise being anti-inflammatory. The healthier you are, the more active you are, all the best for your health and your rheumatic disease. She also had lots of other great tips. You should check out the whole lecture that she gave. She talked about the circadian rhythm and the impact that has, and the time of day and sleep on inflammation. So sleeping well, being active, losing weight, and really emphasizing good, healthy nutrition are all important for diet and rheumatic disease. So lots of good information that you can hopefully take some of those 10 points and bring them back to the bedside, talk to the patient about real practical ways you can not prescribe a pill, but change the way you eat and hopefully impact your rheumatic disease control. Really excellent content all throughout EULAR 2021. It's been a pleasure to cover it, and lots of more information at rheumnow.com. I'm Dr. Eric Dein. It's been a great conference. We look forward to seeing what's coming next on future conferences. Take care.